Well, it's a place that many of us hope never to visit, but if you find yourself in the emergency room, will you get the best care?
News Channel 18's Nicole Kahn looks at the emergency departments at Lafayette's two new hospitals tonight in hospital examinations. Nicole.
Gina, there is little time in an emergency, so if you or someone you love is involved in an emergency situation, you need to know if Lafayette's emergency departments, like the one here at Clarion Arnett Hospital, St. Elizabeth East, or Central, can handle that trauma. The emergency departments at Lafayette's two new hospitals handle everything from routine visits to major trauma. Most people will be treated in the emergency department even if they are badly injured. This includes gunshot wounds, falls, and severe cuts.
We're able to handle a lot of trauma here locally.
We take care of all major trauma here.
But there is always a chance you'll be severely injured. Lafayette has 3 emergency departments, one each at Clarion Arnett, St. Elizabeth Central, and St. Elizabeth East. But none of them have a Level 1 trauma center, which deals with the worst kinds of injuries. You'll have to go to Indianapolis to find that type of care. The quickest way there? Air ambulance. Only a small number of patients need to be airlifted to a trauma center. That includes Methodist Hospital, Riley Hospital for Children, or Wishart Hospital's burn unit. Methodist and Riley hospitals are in Clarion's healthcare network. Statistics provided by Clarion Arnett show only 1% of people who come into the emergency department are flown to a trauma center. The numbers are even lower at St. Elizabeth East and Central. The hospital system says less than half of 1% of those who go to the emergency department are transferred by air to a trauma center. How is that decision made? For Clarion Arnett, it depends on if the patient has several different body systems injured.
Level 1 designation really is for those patients who have multiple organ, or what we call multiple systems failure. So multiple fractures plus 1 or 2 other organs could be involved.
For St. Elizabeth Regional Health, the decision is made based on a different set of criteria. Patients go to a trauma center not because of the injuries, but because of recovery options.
Because they have more extensive rehab facilities, physical therapy, occupational therapy.
There is one significant difference between the two healthcare systems. It's one that can save time, a precious resource in an emergency. Clarion Health has a digital medical record system. When a patient is flown to a trauma center affiliated with the health system, doctors have immediate access to test results done at Clarion Arnett Hospital. That's not the case for St. Elizabeth Regional Health. There is no instant transfer of records.
They end up in their trauma room with their trauma team, and they do the same thing all over again.
Many times, the decision to use an air ambulance is made at the scene of an accident, but even that is a rare occurrence. According to the Tippecanoe County Sheriff's Department, an air ambulance was called to the county 15 times in 2009, but only took people to a trauma center 4 times. This year, a helicopter has come to an accident 13 times and gone to a trauma center 6 times. It's the first responders on the scene who decide if an air ambulance is needed. Some police agencies can make that call on their own, like the Indiana State Police, but oftentimes if a police officer or firefighter is the first to arrive, he or she will wait until a medic or EMT comes to decide to call an air ambulance. If you do end up in an air ambulance, be prepared to pay. Both health systems have their own helicopters. Clarion uses Lifeline. St. Elizabeth has StatFlight, formerly known as PHI. A call center will send the closest available helicopter. Neither service would quote News Channel 18 an estimated cost for a flight, only saying it depends on a variety of factors, including insurance reimbursement, type of aircraft used, and level of care given.
If a patient's going to a higher level of care, a lot of the insurances will cover that.
But expect to be charged thousands of dollars. An Indiana Healthcare Coverage Program or Medicaid memo from 2009 states reimbursement for an air ambulance flight is covered at $3,172.27. I spoke with both air ambulance services, and they tell me there are programs that exist to help people who are uninsured or can't afford the price pay for the medical service. Join me again tomorrow night at 6 and 11 when I find out what could possibly happen with the almost empty home hospital in my special report, Hospital Examinations. Reporting live from Clarion Arnett Hospital in Lafayette, Nicole Kahn, News Channel 18.